Welcome to Healthcare Rounds, your insider access to the healthcare industry. I'm John Marchica, CEO of Darwin Research Group. Over the last decade, specialty pharmacy has really been one of the most dynamic and high growth areas in healthcare. And so today I'm really excited. We have Tim Affeldt, Vice President of Specialty and Infusion Operations at Fairview Health Services. So welcome, Tim. Thanks for taking the time.
Yeah, thanks for having me.
So just to start off, maybe tell us a little bit about your background, what got you to where you are today. And it might be helpful, too, to just kind of give a quick overview on Fairview for those folks who may not know about your health system.
Yeah, absolutely. So, my background, again, after I was trained as a pharmacist, I was in that kind of frontline pharmacy role for years, and then got into administration in pharmacy. And then after a few years, I ended up at Fairview Health System about 13 years ago. And in this role, I have been involved in our specialty and infusion operations primarily over the last 13 years, and pretty much anything that goes into that care delivery for our patients over the last 13 years. And then a little bit about Fairview, I think you asked. So, yeah, Fairview is a large, academic and community-based health system, pretty much almost completely located here within Minnesota. We have 10 hospitals. We do, I think, closer to 7 to 8 billion in revenue as a health system. But really anything that a health system has, I think our system does, whether it's hospitals or clinics, both primary care, specialty care. And then I live in the world of pharmacy, where most health systems now over the years have developed their pharmacy capabilities, both acute care, which probably came first, and then ambulatory care, ambulatory operations, most likely over the last, 10 to 25 years, depending on the journey of the health system.
Well, this may seem pretty simple to you, but for our listeners, what differentiates specialty pharmacy from traditional pharmacy, and think about also the value that it brings to patients?
Yeah, absolutely. So again, the simplest answer, and there are many definitions of specialty, but the simplest answer is, usually they are drugs that are probably more expensive or considered more expensive, although you can debate on what does that mean. And there are different levels of what people think are expensive, but also, kind of greatly requires additional handling. So often there's prior authorizations, additional needs to help the patient, get on their medication, and we call those like access management teams. There's a lot more needed in terms of like clinically managing these patients. These drugs are expensive. We need patients to be successful. We need patients to maybe navigate through some adverse reactions or side effects to the medication, but still stay on the medications. So often you have maybe more intensive or clinical teams involved in the management of that patient's medications with them so that they are successful. And then often you got maybe special storage requirements, or there's a little bit more intensive in terms of getting the medication to a patient in terms of cold chain and keeping the drug, within a certain temperature range and getting it to them out in their home. So that's really what separates what's called specialty versus kind of your traditional retail pharmacy where, everyone in America basically knows you can run over to your corner drugstore or whichever drugstore you use and pick up a medication. Usually these specialty meds are ones that you cannot do that. And that's often maybe even determined by your payer will determine where you can pick up your medication. And that certainly is a difference with specialty is your insurance will have determined kind of where you can go get your specialty medication.
Makes sense. So just a minute ago, I mentioned or made a statement that specialty pharmacy was high growth, right? And a dynamic segment of healthcare. So, Tim, what do you see is driving that growth? What's behind that? And I guess alongside that, what would be some of the key trends that you're seeing in specialty pharmacy?
Yeah, I would say the driver is really innovation. You've had drug manufacturers really focus on specialty medications and the development of specialty medications and medications for rare disease. Certainly, 20 years ago, a lot of these therapies didn't exist. And patients didn't, and doctors just didn't have a lot of options for good treatment, and have completely changed. Getting diagnosed with a specialty disease state, getting diagnosed with a rare disease. Now you can still live a relatively normal life and normal lifespan, and that is definitely a big difference. So I would say innovation continues to be what drives the growth within specialty pharmacy.
So when I think of innovation, at least the way that you describe it, I was thinking of, the pharma companies. I don't want to say that they've got, let's exclude oncology, let's exclude cancer for a second. Not that they have everything solved from a medication standpoint, but a lot of the big categories, it's now we're in the world of incremental improvement, right? With cholesterol drugs or blood pressure medicines, things that have been around a while. And so the innovation, as I see it, and the way you described it, is on the pharma side. But what about on the Fairview, or in general on the health system side? Where do you see the innovation there? I mean, I know there are a number of health systems that didn't have specialty pharmacies, have stood those up over the last decade, but
Yep.
Where do you see the innovation coming from on a health system side?
Yeah, the same. I mean, the development of specialty pharmacy, the development of ambulatory pharmacy capabilities is certainly part of that. And most health systems have been on that journey the last 10 to 15 years. If you went back 15 years, there probably weren't very many health systems doing specialty pharmacy. It might not even have been called specialty pharmacy 15 years ago. We got into it in the late 90s, really by the genesis of our system needing help when it came to transplant medications and those patients. And that's really, it wasn't called specialty then, but that's been almost 30 years ago. And it's evolved to this point again. So where our system is also innovated is just care delivery and having some of those specialties and specialists that we probably didn't have over time. And then creating an environment of being able to get patients to come in and see those providers. And then integrating care, because often with some of these disease states, you need to see multiple specialists. So kind of innovating and making that more seamless, making sure that your different specialists are talking to one another, making sure you're able to transition like pediatrics to adult when you have a specialty disease state. And that's usually where it starts with rare disease. Some of the innovation too has been like, screening at birth and identifying and better screening and better identifying these patients that maybe went undiagnosed for many, many years. That's some of our other innovation that we've done within our system and systems are doing is how do you identify patients quicker? How do you make the correct diagnosis quicker? And I think that has also contributed to growth, within specialty pharmacy.
So that patient identification, do you see that coming more on the pharmacy side, or that's more on the physician side? Who is involved in that process?
Yeah, it probably depends by system. I mean, in our system, pharmacies really tried to partner with our service lines and our providers and our subject matter expert docs. Because I'm at an academic system, we obviously have some of those specialists that not every health system is going to have. You often will find that in a more academic system. And really it's working with them. But, doctors and those provider groups and our service lines, they're the experts. They're the ones that can really articulate what would it take to earlier identify a patient. Are we retrospectively looking for 10 different things that show up in the electronic medical record? And if that patient's had 7 of those 10, then we need to flag that. Maybe we need to take a closer look, and maybe we've missed a diagnosis, or we haven't pulled all of the information together. And, that's some of the activity that now goes on that allows us and I also think we have, more sophisticated electronic medical records that can also keep data and allow you to pull information together to do that type of earlier identification.
Thank you for that. Tim, I think a lot about, and we've actually done some research in this area, the kind of competitive dynamic that's going on between these health system owned specialty pharmacies and the big box, the big players, right? Can you just talk a little bit about that competitive environment and how, I'm not asking for the secret sauce at Fairview, but how that you can be very competitive in the face of, everybody wants the patient, right? And so I imagine you're in a situation fairly frequently where someone is in your care in specialty pharmacy and a month or two goes by and all of a sudden, boom, somebody comes in, and whether it's a Credo or not to name them specifically, but talk a little bit about that competitive environment and how how you can succeed in that world.
Yeah, I think it is very competitive, obviously, and I touched on it earlier. Often your payer, at least in the commercial market, obviously within the Medicare market, Medicaid market, you don't have the same necessarily scenarios. But in the commercial market, certainly a patient's insurance will really tell you kind of where you can receive your care. Not only do they tell you maybe which hospitals, clinics, whatnot you can use, they often may tell you which pharmacy you can use. And that certainly holds true for specialty pharmacy. So really, that's where it starts. And health systems like us, I think it's really about identifying what matters and identifying that it's about the patient. And what can we do to make sure that that patient is successful? What can you do to make sure that that patient's experience is a very positive one? And then providers. I mean, providers got a lot to manage right now. There's a lot of fatigue within providers. So what can you do to make the provider's life easier and to be more seamless with that provider? And that's really what we talk about, think about. And I think a lot of health systems do the same thing. And I'll be honest with you, I think that's where we win. I think because we are part of the system, we just have, we obviously will have a different ability to interact and integrate and collaborate with providers, which provides a better service and a better experience for the provider, but also for the patient. So we think that is very measurable, and we can certainly show that we do very well on the experience and the ease of use. And I think that's very important in our world today, is that we're in such a complicated, kind of crazy world. People are looking for, how do you make things easier, and what does that experience look like? But then after that, it really comes down to value. And how do you create value? And we believe that because of being part of the system, having our pharmacy teams within and integrated with our care teams and service lines, we can make better decisions. We can make decisions quicker. We can manage a patient quicker and better, which will, we believe, produce better outcomes and better value, which we do think is a good message for the payer, that they will consider and they will listen. Maybe not all of them, but certainly some of them.
So you touched on this a little bit, but let's get a little bit more specific on the patients, what are some of the barriers that patients experience when trying to access some of these specialty meds? And how are you able to directly address those barriers and those concerns?
Yeah, I mean, the first barrier one is just access, where they get their med. Because most patients, keep in mind, they just think, okay, I'm just going to go down to my corner drugstore and get my med. So that's the first barrier. Right away, they're like, well, what do you mean I'm going to get a call from a pharmacy and I don't know where this pharmacy is and I can't go look at my pharmacist and talk to them? Like that is a very strange experience for a patient. And I consider that a barrier right away because, some patients even are like very reluctant with that. And really they may not even start their medication because this is just very unsure for them. And then it moves into barriers are usually then there's a process around the prior auth. And again, that may not be something they're that familiar with. Like, why is this going to take some time? And my doctor already saw me. My doctor knows what I need. We talked about it. We talked through it. My doctor knows me better than anyone, except maybe my pharmacist. And now I'm learning or hearing that there's a delay and I'm not sure what's going on. And you need all this information from me. And you need all this information from my doctor. So that's a barrier and that can make a really poor experience for patients. And then when all of that gets done, then there's maybe the sticker shock of, and how much this is going to cost me? Like I get that I signed up for the family deductible of, $8,000, but I didn't actually think I'd ever have to pay $8,000.
Right.
So that's a huge barrier. And again, I think, teams and certainly my team and many, many specialty pharmacies do focus on that, probably some better than others. But I believe that's part of what you do as a pharmacy provider is it's your job to eliminate barriers. And certainly one of those, and probably one of the biggest ones, is the barrier of what it costs. And even though you might have signed up for that to kind of lower your premiums and having a higher deductible, all of a sudden you get hit with that large amount. And that can be pretty eye-opening and frustrating and for patients. And often they decide that, maybe this isn't the drug for me.
Sure. One of the things that we've noticed over time, there's this sort of a shift toward home and alternate site infusion services. And I'm just speaking broadly. How have you adjusted to that? How have you addressed that? Or am I mischaracterizing it? Maybe in Minnesota, it's not the same thing, but I'm assuming it's similar. So knowing that it's not just in the hospital and home health playing a bigger role, and as I said, other alternative sites, how have you addressed that?
Yeah, for us, it's really making sure that you can go to the patient, treat the patient, having those levers, having all of the really what we call sites of care. So we addressed it, luckily, even before I got here. They started home infusion. We had we have infusion centers, and we have hospitals, and we have clinics. So anywhere that a patient needs to get their medication, or maybe their insurance wants them to get their medication, we can do that. There's no issues with that. So again, and I think that's why a lot of health systems actually right now are taking a pretty close look at infusion and making sure they have a kind of a complete infusion strategy. The home is probably the most difficult. And I'm probably biased because we do it and I oversee that. But again, it's not about us. It's not about Fairview. It's about the patient. And if the best thing for that patient is to go see them at 6 p.m. in their home because then they don't have to rearrange their work schedule or their school schedule or whatever they need to do, guess what? Then I need to show up there. I need to take care of them, and I need to make sure they're successful. And that's why, we believe you need all of those sites of care and you need to go to the patient. You need to meet patients where they are. to help them be successful with their therapies and be successful and live, a normal as possible life.
Can you think of any specific innovations or technologies, addressing that patient experience and being able to meet them where they are? Is there anything that's come up that you can talk about, say, in the last couple of years that you're excited about that's helped you improve the patient experience along those lines?
Yeah, I think just, there are some virtual things now. Obviously, the whole world went more virtual with COVID, but that includes patient care. Like, we are able to interact with patients differently. You're able to do video calls. You're able to be more readily available. It's a lot of times with patients, they want the security blanket of being able to talk to someone pretty much anytime they want. So I think that's made the experience with patients. A lot of patients don't want to necessarily just talk to you on the phone. So really, are you text messaging them? Are you emailing them? Are you calling them? Are you video calling them? Like, what makes sense for that patient? I think that's made things much easier for patients. And really, what's their preferred platform for communication and exchanging information? I think that's changed, obviously, quite a bit the last 5 years. And I think that's made it very different for patients. And I think just having things be more streamlined, maybe between pharmacies and your providers, and putting all of your information maybe in one place, that is much more streamlined and much more, it keeps providers much more informed when they're making decisions about care and sharing of information. Maybe where I have a nurse in the home and that nurse is noticing something and can get that information to the provider much easier now. I think that makes a big difference for those patients.
So here at Darwin, we've done a lot of work on, for many years, on these value-based initiatives, value-based contracting, and things like that. I'm curious about the intersection of specialty pharmacy and any number of these value-based programs. Are you partnering with payers, or do you have other? And again, I'm not asking for anything specific or secretive about Fairview, but are you partnering with some of these organizations for these risk-based models in the value-based arena? And if you are, can you give any examples of specialty pharmacy in the value-based world?
Yeah, I think at our Fairview, and again, this is an area I don't know as well, but most of our value-based, and we do have many lives in the kind of value-based arrangements. It does heavily focus on chronic conditions and primary care and some of those disease states you would think of. I would say that there is less of those kind of traditional value-based contracting within specialty pharmacy, although I still think there's a lot of value-based or value strategies going on between a pharmacy, like Fairview, and payers, where we look at different things. It's maybe not tied to just a contract, or it's more tied to, how do we partner better when you're looking at things like biosimilars? How do we partner better when you look at things like generics? How do we partner better when you look at things like appropriate use or appropriate dosing? Those are the things I think are more common within specialty pharmacy. That I think that most providers and then payers are able to take a closer look, and you can create value. And I think that's also a place within a pharmacy that you can look to say, what can you do? How can you support those types of initiatives that payers are looking at, in terms of, obviously, this is a category that's exploded over the years now. And certainly top of mind for payers and employers is the drug spend. Drug spend was just an afterthought probably 15 years ago. And that's completely changed over the last 15 years. And now that drug spend is a much larger percentage of that health plan spent.
So how do you see, looking to the future, how do you see specialty pharmacy evolving within the health system? What are some of the things that, you've given a great snapshot of where we are today in a bunch of different areas, and as it relates to patient care and collaborating with other people within the organization. But as you look forward, I'm sure that you see that there's more that you can do or do things differently. What's on the horizon?
I mean, I think it's a lot of automation and the use of AI more. When you think about kind of the things that are still, maybe concerning, you think about adherence. You think about access. If you're going to spend this kind of money on these kind of drugs, you really do want patients to take them, and you want them to be successful. So I think there's a lot that could be done with automation in terms of adherence. There has to be better ways of knowing how patients are taking their meds and when they're taking their meds, and if they are having an adverse reaction, how do you manage that adverse reaction? I think there's a lot more we can do in terms of collecting information from the patient. Even with them, really not even like they would know we're collecting information, but it would just be part of their everyday routine, and it would just feed data back to the pharmacy and to the provider that we could make better decisions on how their care is going. So almost just kind of like that, whether it's wearables or different things related to drugs, some pretty interesting things that are coming or are out now. I do think that will be part of the future. Which I think can really help improve. You think about the billions of dollars that are wasted with problems with adherence. I think that will be one place that can really be made a difference in the future with AI and automation. And I do think AI and automation are going to change this whole payer provider dynamic when it comes to prior auth and benefit investigations and figuring out a patient's out of pocket, and do you really need all of the hundreds of thousands of people right now that are literally sitting on phones doing this type of work? I don't think that's how it needs to be done in the future, and I think that will drastically change the market. Because it can take a lot of the expense out of the market, and that allows you to think differently about your revenue if your expenses are different.
Before we wrap up, and just thinking about the next generation of pharmacy leaders, what do you wish that they focused more on, or that they focused on at all, in your typical pharmacy programs? We have actually a couple of people here, one in particular that's working on a PharmD. But what's missing?
Well, that's a great question. Although we do work with a ton of learners around here, I'm blessed to have some amazing young leadership coming through Fairview. I said maybe, at times I say just remembering the patient and just that personal touch and the one-on-one interaction, because the world's gotten so virtual. We almost forget about the face-to-face. It's almost funny around here when I say, oh my God, you have an in-person meeting, like you're actually going to meet with someone and like face-to-face. So I worry a little bit that almost like the personal touch and things are going to become so automated and almost like lose that personal touch. So that'd be one thing that I would talk to young leaders about, like, what are you doing to maintain that? What are you doing to maintain that it is about the patient? It is always about the patient, no matter what. You should start with, is this the right thing for the patient? And I think that at times gets lost. So that's certainly one thing I would tell them. Another good thing, though, a positive thing, like, old guys like me, we struggle with technology and that type of stuff. And young leaders don't. Like, they grew up differently. I think about what my kids do now, right? So leaning into automation and AI and the wonderful and amazing things of how I think they can change healthcare and pharmacy, That's where they need to lean in. That's where they can really make a difference. That's where they can come along and help a guy like me, where I don't, that some of that stuff just doesn't come naturally for me. So I think that would be two areas I would tell every one of our young leaders here at Fairview.
Outstanding. The last question, broadly speaking, we could spend a whole episode on this, but I'm just going to leave it with this one question. What can manufacturers do better in their engagement with you, in the way they, it could be a long list of things, but just thinking broadly speaking about pharmaceutical manufacturers, what can they do better?
I think one, they can listen better. They can focus on, you truly want a relationship. You don't just want a transaction. And I think that they can also focus on making it easier on us. Lots of teams, might have 30 different people call us from one drug manufacturer. Like, it doesn't have to be that way. Like, how do you make that easier? How do you make that simpler? Some companies have figured it out. But we're all really, really busy, but we need really timely information, and we need information right when we need it. So how do we do that? How do you do that? How do you truly make our lives easier for our patients and make patients' lives easier? That's what I think they could do better. And some of them are, don't get me wrong. So
I was going to say, without using any names, no company names, no people's names, can you think of a relationship, or you think of one that's really working well for you, and what are kind of those attributes of what these suppliers are doing right by you?
Yeah, and I touched on a little bit. One, I really do think that when you have kind of the face of your company that can answer anything and all things, and kind of full portfolio support, that makes a big difference. I think folks that have taken the time to really research health systems and understand health systems, and you just don't default to your one known strategy for national coverage for your drug. I think that makes a difference when folks actually have taken the time to understand the health systems.
They can speak your language, in other words.
Yeah, they've taken the time to do that. Some of them have even hired folks from health systems, but they've done their due diligence. They've understand our system. They understand our pain points. They understand what we might be thinking about. And then they bring ideas. They bring solutions. One of the best things about drug manufacturers is they literally go into all 50 states and they see things across all 50 states. Like, I can't see that. I have some really good partners at pharma, and they bring some really interesting stuff that, like, hey, we just saw this health system doing this in another state. Like, what do you think? Like, tell me more. Because trust me, health systems love to just steal an idea from another health system. We don't have to be the one that discovered it. I'm fine taking a really great idea from someone else and implementing it here if it will help our patients. So I think that's what pharma could do much better at.
Well, Tim, thanks a lot. I really appreciate it. How can listeners follow your work or get in touch with you? What's the best way to connect if they need to?
Yeah, I think just reaching out to me, either through HOSP or through Fairview. That's usually the best way to get a hold of me. I'm usually very open to connecting with anyone and everyone.
Outstanding. Well, again, Tim, thanks so much. Really appreciate your taking some time with us today, and I wish you the best. And I hope we can keep in touch.
Yeah, absolutely. Anytime.
So that'll do it for another episode of Healthcare Rounds. Our guest today has been Tim Affeldt, Vice President of Specialty and Infusion Operations for Fairview Health Services. And as always, I'm your host, John Marchica, CEO of Darwin Research Group. If you like what you heard today, make sure to subscribe and leave us a rating. And if you haven't already, please follow us on LinkedIn and on YouTube. See you next round.